that's how we are integrated. Because then you can talk normally when you integrate a therapist with a doctor. What would the doctor expect from the therapist? In terms of you can talk about the hypnosis partner. So perhaps proper. How do you work together? What are the things? So Dr. Nomas, you just figure that out, lah. and Datuk Pillay, MOH has always been talking about integrative science, integrative medicine. What are the lookouts? Patient care, uh, understanding anatomy, physiology, so you can integrate better. Education,
Evidence-based.
entry level, or health, all those kind of things.
Okay.
But the main thing is to entice. Some example, like I would talk about, I learned from this guy, Dr. Jack Gibson, FRCS in Ireland, and he had done 4,000 operations with anesthesia. And this was during the war in Africa, where they ran out of medical supply, and he had learned hypnosis. And he used hypnosis for amputation, chest operation, eye injury, all kinds of things, because there was no anesthesia then, and hypnosis was very good for pain management and helping people, cope with it. So that's an example. So you can talk about depression, because now mental health, So this whole thing is towards mental health. Also, one of the things that maybe Dr. Nomas, you can say, many doctors are reluctant to use this because they say, look, I've got only 10 minutes with my client. How am I going to use hypnosis? That's where we can say, with scientific hypnosis like ERT, in that 10 minutes, you can create a patient, to make them at ease, like fear of needles, fear of this, or you can do some pre-preparation before they go into a procedure. All those kind of things, preparation, especially like dentistry, you can relax them. A lot of people are not relaxed, so you can relax them, stress, so many things, You just, I bet you when you start talking, you cannot stop it.
How long are you going to have the session?
We're going to have it, I think it will normally go about 1 hour max.
Okay.
Because once we got the video, we can send it to everybody. Remember, the whole idea of having this video is because
Julian, you're live. Hi, Julian, you're live.
We are live now.
What?
We are live now.
Okay. Hi. Good evening. Thank you for coming today, and we are glad that you are joining us for our Facebook Live. And today we have two wonderful guests here, and our topic today is integrative medicine with hypnosis. So let me introduce you. We have Datuk Pillay, MS Pillay. He was the former Deputy DG of Health for TCM. He's a government and medical health advisor. Welcome, Dr. Datuk Pillay.
Hi, Julian.
Yes, hi. Yes. And on our other side, we have Dr. Nomas. Dr. Nomas is a medical officer as well as a nutritionist. Welcome, Dr. Nomas.
Hi, everyone. Good evening. Hi, Mr. Julia. Hi,
And
Dr. Pillay.
amazingly, both of them are also trained hypnotherapists. So today, let me introduce myself. I'm Julian Leicester, the chairman for the Malaysian Professional Hypnotherapy Association, and also the CEO for the United States Board of Clinical Hypnosis. Datuk Pillay is our patron for MPHA, and Dr. Nomas is also our council member. But what we are here to share is we are inviting all medical personnel to listen to us because we got a great story today. So let's begin. I have a question here for you, Dr. Nomas.
Yeah.
how are you using hypnosis in your treatment
Okay.
as a medical person?
As a medical personnel, I'm very glad and very grateful to be part of the the chemotherapy world is because I find it is a very useful one. So maybe I can, from your question here, I can share a little bit about my history, like what I learned and what I do and how I treat all those patients. So first of all, definitely thanks to Mr. Julian and the team to invite me tonight here to be here to give you and share with you all. Human therapy actually is a very useful and good therapy in which number one to be a medical doctor, it definitely will bring up my value. So behind the scene, maybe we can charge a little bit extra from our patient. Is because we bring up our value. We are not just only a conventional doctor, but we got other than that. And most important thing is that because via this method hypnotherapy, especially clinical hypnotherapy, as what I was practicing about, this method can help a lot of patients to get rid of the fear and anxiety whenever they were diagnosed with disease. A very good example. If I tell a patient, I'm so sorry that you are having a cancer. Out of 10 patients, 9.5 patients definitely will feel very anxious and don't know how to face it. And some of them even find that I don't think I want to live anymore. Maybe I want to commit suicide, etc. And via this method, hypnotherapy, you can help them to change their mindset. Let them to feel a bit relaxed and calm and face all the situation in a better way. So in such a situation, when you handle your patient gain more trust on you, number one, and number two, they don't feel alone, lonely anymore. So other than that, because when the time you like just diagnosed by with the cancer, etc., they definitely will feel that I don't know how to face it, etc., and then they don't know they got all this kind of phobia, which is a norm. But if you can get rid of the anxiety as well as the fear, definitely the path during the chemotherapy or radiotherapy, they don't feel the same as like a usual patient. Other than that, I also been treating patient using my method via relaxation therapy, especially when I give some kind of like treatment, I provide the relaxation therapy, patient can feel the difference. They can feel the cells like growing even better, which is something we saw quite a bit like a cellular energy kind of things. So that's the reason why I did use the same method for patients who got the 10-year stroke, and eventually they change the mindset. They can experience the changes in their brain, and they can realize that actually the stroke was 10 years back, not reason. Healing does take place in our brain. And slowly they will realize that they gain more power in their limbs, in which they've been experiencing low limb, like the limb weakness for more than about 10 years. So this is what I had before. Like, that's my experience.
Okay, so it's amazing that you said that because what I want to let you know is visualization, imagination, how you project the mind to your patient, help them to see beyond the current outcomes, the difficulty they are as a sufferer of certain symptoms and disease, and integrated hypnosis and with your medical and pharmaceutical solutions, yes, you can actually promote much more faster response and much faster growth. Is that correct, Dr. Nomas?
Yes, definitely. I agree for a certain extent. But other than that, I also realized that this method is very useful, especially if I want to treat patient with chronic illness. So like chronic illness,
Okay.
diabetes and hypertension, example, a very good example. So when you have a diabetes,
Okay.
hypertension, patient with diabetes, definitely they have to control their sugar. And a lot of people, they cannot control their sugar. Regardless how much dosage of the medicine, some people may not have adequate medicine at all. Insulin, you just jab like crazy and you pop all the pills, but the sugar just not well controlled. But actually, if you use the clinical hypnotherapy, you can control their sugar. Because the subconscious mind of the patient will realize that actually I'm eating all this is very unhealthy. So that's why I will train my patient, like those having obesity or having chronic illnesses, I will train them within 3 months. We will realize whatever you are eating is very unhealthy. And subconsciously, you won't feel that very, I don't feel uneasy, the kind of feeling if I want to control my diet. And people won't feel the kind of like fear or like not good feeling when controlling their diet. They subconsciously will realize that, this fried chicken looks good, but I think I need to be healthier and really look after my diet by right now because my subconsciously already changed. And through this method, you will realize that the sugar control and the hypertension control can be handled in an easier way.
So you're using hypnosis basically to help the patient have better awareness, better critical thinking,
Yes,
and more empowerment towards their health by following all the medical guidelines and advice that you have given them, so that they respond better to the medication and
exactly,
also to eat better. Yes.
exactly,
So
exactly,
this is how what hypnosis become a good tool for in integrative medicine.
exactly, exactly.
Oh, fantastic. Now I'm going to ask another question here now to Datuk Pillay. Datuk Pillay, you have been instrumental in when you were as the Deputy DG of Health for TCM in coming up with ACTA 775 TCM Act. And what is your view to integrative medicine and TCM and allied health practitioner, especially when in today's world where we are talking about integrating with the medical science? What are the lookouts? Can you let us know?
Thank you, Julian. Yeah, it was a long journey in the Ministry of Health those days, getting traditional complementary medicine as a recognized area in the government system. Now, I was in the standing committee at the time, and we were trying to integrate and bring in together traditional complementary medicine practices in the country. And these other practices have been there for a very long time, thousands of years. But when it
Okay.
comes to practicing it, there are many shortfalls. This all has to be regulated so that we can bring it to a higher level. The main aim at that time was for integration. What do you mean by integrative medicine? Is to basically look at a person as a in a holistic manner, looking at a person in a very holistic manner, and to help him in all aspects of body, spirit, and how to do that? It is by combining conventional medicine with complementary and alternative medicine. So combining this conventional medicine with these therapies is what we are trying to achieve. And I think we have achieved that to a large extent here in Malaysia. With the Act coming up, it has provided a basis. The Act is a basis to promote this integration. That was the feeling at the time, and even now I think it is. As much as we can integrate what's out there with conventional medicine for the benefit of the patient, that's what we should be looking for. But integrative medicine recognizes that every individual is different. Every individual is different, so you must consider every aspect, his physical aspects, his emotional aspects, his mental aspects, and also spiritual aspects. It aims to address the underlying causes of illness and promote self-care, prevention, and wellness. So these are the overall objectives of integrative medicine. But you will see that there are many therapies. Already now you will see many therapies such as chiropractic practices, herbal medicine, massage therapy, meditation, mindfulness, nutrition, counseling, yoga, and hypnotherapy. Hypnotherapy is recognized in many countries now world over as a complementary therapy that will go well together with conventional medicine. But we have to be very careful. In integrating medicine, we have to be very careful to keep to certain principles. What are they? It should be patient centered. Patient should be the focus of all these approaches that we are doing. whatever conventional or even traditional and complementary, patient should be the center of focus. And we have to look at all aspects, including the physical, mental, emotional, spiritual. All of these things must be looked at. But how often in current conventional medicine do we do that kind of complete assessment? It doesn't. Sometimes, as you were saying just now, Julian, the time given to the doctor to look at a patient is just less than 10 minutes. How can he do this complete assessment? That's why there should be many other approaches where these whole aspects of health must be considered. Evidence-based. Now, when we were in the ministry, and I remember Tantri Ismail American always mentioned, evidence-based should be the cornerstone of whatever you do. So we have to have evidence-based practices, and many of these complementary therapies, they don't have the chance to develop this evidence-based. So research support must be given to them to develop what they have in evidence-based approach. Now, collaboration and coordination. Many conventional medicine trained doctors treat alternative and complementary medicine therapies as quacks. Just write them off as quacks. But there's a lot of good that's happening there. And some surveys have done that many people depend on complementary and alternative therapies in their day-to-day healthcare. So we have to take note of that. Important thing is collaboration and coordination. How do you coordinate the different therapies with conventional therapy? Now, all this requires open communication. There must be trust developed. There must be open communication, where conventional trained doctors must find out more and get involved in conventional therapies that have proven to be successful. So they must learn more. Because some patients will do the research and come to you, you must at least know what they are, so that you can help them. And the emphasis should always be on prevention. No point doing the curative part only. Prevention should be the emphasis, and recognizing the lifestyle factors for which lifestyle changes can be made. I think hypnotherapy is a fantastic tool that we can use to effect lifestyle changes. So these are some approaches, Julian, that we all should consider when we talk about integrating complementary medicine with conventional medicine. Thank you.
So it's very important that today I've been doing hypnotherapy for 23 years. And over the years, while we are growing with our techniques in hypnosis, a therapist should also have a hybrid knowledge, not only just in anatomy, physiology, the human parts and the body, yes? Because if you don't know that, how do you want to talk to the doctor in their language, yes? Because you need to work in integration with your doctor and medical person, especially to help the patient or the client, yes? As Dato has said, the client is the main focus, yes? Then there's also having proper documentation, like you said, case studies, has to be locked down correctly, and more than anything else, the hypnotherapist has to be constantly improving in his studies and education. Yes. So today I want to ask a question here to Dr. Nomas. Why should a doctor learn hypnotherapy? What do you think is it a necessity or is it just good to have?
Okay. Being honest, this question is a bit tricky. But okay, this actually is both ways lah. Okay, depends on how you utilize this method. If let's say you got the skill and you use it well, definitely it is a necessity. Example, how I use chemotherapy for myself. As we know, as a medical personnel, we've been working hard, and then every time we're tired, always face patients like to complain to you. If I don't have used this skill, without this skill, I definitely will develop a little bit of like depression or the kind of issue, because I am full of a negativity. Patient always complain to you. Patient's family always complain to you about their family issue, etc. So what we can do is that we use relaxation therapy, which is part of this clinical therapy, to relax our mind, to recharge our energy and recharge our mental health, so that we can, by the time we face the patient, you will tell in a different way and they can feel the difference as well. They'll find that you are a really different doctor compared to those conventional doctors that I met before, that kind of thing. This is what the compliment from my patients. And other than that, I find
Yeah.
that it's good to have is because if you got this skill and you learn this, it's not only for yourself. You can also apply the same thing on the patients. So whenever you have this skill, like example, whenever I meet a patient, I will sometimes trigger my subconscious. I will use a different hat and use their language and speak to them. Because if you face the young patient, you have to use different way to communicate with them. But if you meet elder patients, then you have to use a different way to communicate with them. And if you meet a person who is less educated, you have to use a different way to communicate with them. Because what as a real doctor want actually the outcome of the patient disease. If the disease being cured, you are definitely doing good. But if you are treating a patient just because what the patients want, you are not doing good, being honest. Because what the patients want might not be good for the patient. So in the end, the outcome is not good. So in this method, I'm trying to do is that every time before I speak to the patients that I want to meet, I will trigger a little bit of my subconscious mind using my clinical hypnotherapy. So that's the reason why I'm using this skill. Every patient understand what I'm telling them. At the same time, they feel a bit more secure and more confidence in you because they realize that you are a bit different from a normal doctor. Instead of like, doc, I got this problem, I got that problem, I think I want this, I want that, that kind of thing, and then you prescribe and let the patient go. Because nowadays, you must understand, medical world started changing, especially after the COVID incidents. Everybody realized medicine might be useful for a certain extent. It's good to have medicine if you are having disease, definitely, but it may not be adequate. So that's the reason, back to just now I mentioned chronic illness, a very good example. A patient with diabetes, okay, a conventional doctor maybe prescribe you a medicine. Sugar very good. Your kidney function is very good. Liver function is very good. But then your limb to be amputated. I experienced these patients before, these incidents before. Patient cried in front of me, say, "Doc, because of you, I changed my sugar. I changed everything. I take the medicine on time, follow your instruction. Now my sugar is perfectly well. Every time being controlled, being less than 10. Then why my limb is the one being amputated? Something is not right. May not be adequate. Maybe it's due to diet, etc. But when you time you want to control the diet, they cannot control because, as we know, Malaysia is a place with food of heaven. So that's the reason why we have to trigger their subconscious mind. Whenever they look at the nice word, yes, it's good to have. But tomorrow, I will change my diet plan again. Why? Because the subconscious know that yesterday I had something bad. Upcoming, I'm going to have a bit healthier in order to allow me to enjoy my life. This is the reason why everybody must age gracefully and live gracefully. Yeah, this is what I want to say.
Okay, I just also want to, because I train people in hypnosis, and I personally have been trained by a certain Dr. Jack Gibson, who was an Irish FRCS surgeon in Kildare Island. He has been an Irish folk hero in his days. And there are many functions, if you look at today, on hypnosis application in the medical world. Hypnosis is also in surgery today. Hypnosis is in oncology, radiology, pediatrics. It's very good for respiratory, like asthma, and also in nursing, in dentistry, yeah, in psychotherapy. So the application of hypnosis is the spectrum of hypnosis is usage is really all over in medical science. And so there are so many procedures, there's so many depth of knowledge. A lot of people, when they ask me, oh, is hypnotherapy just you close your eyes and I will talk to you like a progressive relaxation? And so that's what hypnosis is about. No, it's far more deeper. There's exploration. You can regress. You can do addiction therapy. You can do even couple counseling. You can just access the subconscious mind, which is, to me, I call it the operating system, the background mind, to go into deep-rooted issues, to go into behavior with the conditionings at subconscious level and make those changes. So especially like patients who are going for surgery, hypnosis is very good to help them to do pre-preparation for surgery. In fact, I've been in 2 surgery with hypnosis, and I can tell you firsthand that especially as a patient, sometimes when you go for surgery, there's a lot of fear, palpitations, expectation. Then there's also post recovery too. So hypnosis can also help with helping the patient towards better recovery. Not in the sense of so that they feel more confident, they feel more comfort in the whole process. It's also very good for pain management. All the aches, the pains, that, and we can sometimes chronic arthritis, allergy too, because everything is at there's a lot of psychosomatic symptoms that we can elevate. So I was taught by Dr. Jack Gibson. Jack Gibson was famous because he had done 4,000 operations without anesthesia. He was interviewed by BBC. Yeah. And he had no choice at that time because he was in Africa and he was a doctor there. And during the war, they had run out of medical supply. And he had learned hypnosis then. And he had used hypnosis during the war and did things like amputation, chest surgery, wounds, eye injuries, and he had worked with hypnosis. And these are the techniques that some of them I learned when I learned from him in London. And it's amazing as to the power of the subconscious mind. So where we are going today in hypnosis is a totally new journey. And the reason why we are having this Facebook Live is because as an association, we are bringing down an expert, Tom Silver. Tom Silver is the president of the United States Board of Clinical Hypnosis in Oregon, USA. And he's coming down in KL on the 17th of July for a 5-day program. And our association, MPHA, is organizing this whole 5-day scientific hypnosis course. It's a certified course. And one of the things you have to understand is today's scientific hypnosis integrates into medical science. Because we are not only with hypnosis, we are using devices like EEG and neuroscience devices. So the hypnotherapist today is understanding how hypnosis alter the mind, its chemistry, the body functions in the brain to achieve a certain behavior results. So these are the things that we are integrating into science of hypnosis in such a way that we can assist into medical science better. So this time, we can, especially like if a hypnotherapist works with Dr. Nomas, for instance, if I'm working with Dr. Nomas, we know our boundaries where we are. Yeah. Dr. Nomas will probably be doing his treatment from a pharmaceutical and medical point of view. But for rehab, for recovery, he could get the hypnotherapist for the motivation part, to keep the client going. I always remember this when I was in attending meetings with MOH. They always say, doctors are like the human being is like a car. If you miss an accident, go to the doctor. They are the best at it. No one can challenge them because they know how to put back the shape and repair back the car, But at the therapy level, we are like the service center. We make sure that the car is polished, the tires are clean, pumped, and we make sure that the car is at optimal performance. And so this is the way we integrate with each other. And hypnosis is one of the closest, I would probably say the only tool that's in the surgery room. Only tool that's in the surgery room. Yes. And so today there's an opportunity for all of you all, especially any doctors there, any psychiatrists there, to come for this program by Tom Silver. In the Malaysian Professional Hypnotherapy Association, we have psychiatrists, we have doctors, we have counselors, psychologists, lay people, who have been and take the journey to be a hypnotherapist to help especially support our mental health agenda in this country. And hypnosis is really one of the fastest tools to help someone. It's very rapid, it's very comforting, it only uses the mind, and it achieves some very good results too, especially in certain areas. And so this is an opportunity. Datuk Pillay, would you like to share something that for this training?
Julian, actually, as you mentioned just now, this is the opportunity where Tom Silver himself is coming down. And what he has done, Tom Silver is an experienced hypnotherapist. He has condensed a lot of the traditional approaches of hypnotherapy into very effective modules. And he is presenting it in a 5-day course, which basically you're getting a shortcut to complete hypnosis training. And he's giving it over 5 days, and that will be American board certified, and you can call yourself a certified hypnotherapist after attending the course. I think it's a fantastic opportunity. You don't have to go to US to get this. He's coming down here and he'll certify you. You'll see him live and you can learn a lot from him. Now, I'm looking forward to this course myself. And in the field of anxiety, depression, and stress management, I think there's no better complementary therapy than hypnosis. So, and these are all proven.
Yeah.
A lot of scientific studies done, proven all over the place. American Medical Association has also recognized hypnotherapy as a modality to be recognized with, and so we should also make this opportunity available to all our medical practitioners here who want to get one additional qualification that can improve their practice of medicine. So I hope as many of you will join us. The fee, as was mentioned, I think Julian has not mentioned the fee. The fee is very reasonable when compared to attending it personally in US. And this world tour that Tom Silver is making is very rare. And he's using Malaysia as a center for exposing hypnotherapy in this part of the world. So we will become good examples for others to follow. So I urge as many of you as possible to take this opportunity and don't miss it out. It's not always that you get this kind of chance. Thank you.
Dr. Nomas, what would you say to all your doctor colleagues about this
Dear
course?
fellow doctors, try to figure out, think beyond the limit. You will realize that this is something really useful, and it's definitely your patient will treat you like different. Not only you yourself treating your patients, but patients will treat you in a better way as well. Because this is good to have all these treatments combined together, bring more value for yourself as well as your patients. Definitely, you will realize that those patients very difficult in treating them. Eventually, they will be treated in a better way and a healthier way with our method integrated with healthcare. Yeah.
Okay. Well, I want to tell you this. Tom Silver will teach you emotional replacement therapy, ERT, and that is really cutting edge. In 15 minutes or more. You can help people get out of some fear, relief of fear, some symptoms, some negativity,
Needle phobia.
and yeah, and it really works because I can vouch it because I've used it, and I've been a therapist for 23 years. So and I can tell you that hypnosis really works, and if you can do something in 15 minutes, you can integrate it into your medical practice with a client. So you this way you're not taking too much of your time, but actually you're giving them patient comfort, and taking it in a taking your whole practice, like Dr. Noma says, in a much more value added way. As for the knowledge you're going to learn in this program is you're going to learn all the basics on hypnosis, but not like how it's taught in traditional hypnosis. Tom Silver is 40 years into this world of scientific hypnosis. He started teaching 40 years ago scientific hypnosis with device, with EEG, and his experience is really a wealth. He has he has worked with doctors who are in Stanford universities, in universities all over the world. Some of the top doctors in the world are his students. So you're going to learn with someone who is not just a lay practitioner or some lay trainer of hypnotherapy. No, you're talking to America's favorite TV hypnotist. Tom Silver is the world brand on scientific hypnosis. So come and learn, and you'll be also offered membership into our association, Malaysian Professional Hypnotherapy Association, and we are a team of lay people, doctors, psychiatrists, and even our patron, a former deputy DG of health. And we are growing as a team of scientific hypnotherapists. So I'd like to thank you today. I'd like to thank Dr. Pillay and Dr. Nomas for sharing with to all of you all an opportunity. Tom is coming first time to Malaysia, and then he's going to China, and then perhaps to Canada, and he came from Holland. He's on his world tour, and he's making Malaysia the hub for scientific hypnosis. Take this opportunity. You will never get it. The price of this training at this time is only 8,000 ringgit. It's cheaper than the flight ticket to America. In America, this cost is 10,000 US dollar, and he's training in China for 6,000 US dollar. He said, since he's making Malaysia the hub for Asia, for United States Board of Clinical Hypnosis, and I'm going to be his CEO, I'm going to tell you this is the cheapest place in the planet to learn scientific hypnosis from a world-renowned hypnotherapist. If you look at today local hypnotherapy courses, they range between 4,000 to 15,000. And here you're getting someone who is doing it for a bigger price. So come and join us. Come and join us today. Join us in this course. And below you'll see some links.
Chief, your
on how
mic
you can
shifted.
get
Your mic. Your mic shifted, Chief. Yeah, a bit soft.
Can you see me here? Can you hear me now?
A bit soft.
Okay, let me see. Are you able to hear me?
Yeah, much better.
Okay, so that's the links that are given below. How you can get information on this training program. It's going to be in Capital Hotel in Bukit Bintang, in the heart of the city. And you can come and spend 5 days with Tom. Learn everything you need. And by the way, it's only 5 days of your life. Only 5 days of your life to get a US education in the soil of Malaysia from the United States Board of Clinical Hypnosis. So with that, good night, everybody. And thank you very much for looking being in our Facebook Live today. Thank you, Dr. Nomas. Thank you very much, Datuk Pillay. And see you at our seminar.
See you all. If you want to learn from the best.
Bye.
The best. Bye.